Today's video is going to cover 3 stretches that you should be doing to help you with your lower back pain or your sciatica. We're going to go through do's, we're going to go through don'ts, we're going to demo it on the bench behind me so you guys can better understand what we're doing, but also why we're doing it as well. And also identify some of the common errors that people make when they do these exercises, which is why they get them so wrong, why they get flare-ups or aggravations when they do these exercises. At the end of the day, these are going to help alleviate the stress on your lower back if you do them correctly. If you do them incorrectly, they're going to actually make your lower back worse, which is going to cause those muscles to tighten up faster again, and you'll be back in this vicious cycle, and we don't want that for you at all. At the end of the video, we're also going to cover one important thing that you must be doing in order to make these stretches and other aspects of your rehabilitation successful long-term and really effectively deal with the root cause of your lower back pain or sciatica and be pain-free and able to do all the things you love again. As always, if you find these videos helpful, make sure you hit that subscribe button and give us a thumbs up. And any questions as we're going through any of this, use that comment section below because we read and reply to all of your comments. I'm not quite sure why I always end up doing these sorts of videos stretching the legs right after training legs, so I'm pretty stiff again today. Hopefully we'll get it right one day. Now, the important thing we first want to acknowledge with all of these is that we are stretching hips. We are not stretching back. And to save me repeating this over and over again through each of these stretches, it's important that you brace your spine so that it does not move. That means there's going to be a degree of tension here from the lumbar erector spinae muscles holding the spine. There's going to be core engagement, holding everything nice and tight. Because naturally, as we pull this hip enough, it's going to pull, for example, in the hamstring, it's going to start pulling on the back or pulling on the pelvis, which is going to pull on the back. So if we've got everything engaged up here, we're going to protect our lumbar spine from moving. And that really is the pivotal point with all of these stretches. Control and isolation of the lower back so that it doesn't move, and we focus that stretch to the hip for a more effective stretch too. This is really one of our integral pillars from the Back in Shape program. It's pillar number 2, which is freeing up your hips to take strain off the lower back. So if our hips are working more, it means when we're doing movements like squats, we're not having to round our back like a prawn to get in and out of a chair. We've got a little bit more mobility. Now we'll get on at the end of this video into some important considerations, but understand that for the time being. The very first stretch is going to be simply a hamstring stretch. And what we're going to be doing here is a standing variation. Sometimes people find it difficult to sit down because there is an important movement that needs to take place. Now, granted, we could do the sitting variation, we could do the standing variation, we could do lying down variations, but the principles that we'll talk about here are true for all of those. It's just that you personally might find it easier to do a specific variation for you. So we're going to start popping our leg onto the chair. And for me, this is already a little bit stiff anyway. So have something nearby that you can support yourself with. If you want a chair or a counter, doing this next to the bed is quite good because quite often actually stretching before bed can be quite a nice little thing to do. We tend to maybe be a little bit warmer in the evening, so we're probably going to get a better stretch through our body anyway, and that helps as well. So we always want to make sure that we do not have the leg locked out like you can see here. We want to make sure there is a slight bend at the level of the knee. What you're doing with your foot and your ankle is really of little consequence. You might find pulling it towards you might be a little bit more intensified. That's really up to you. We're not too worried about that, and you can tweak that in and out a little bit to target specific areas more, but that's really when you're hunting for that stiffness. So that's later on once the stretch has already come on. So we've got the leg up in a relaxed position, we're supported, a slight bend in the knee. Now the important thing here, if we grab the spine, is that we lock our posture nice and tall and hold our spine steady. And all that's happening here is that our bum is going backwards. That movement is important. Notice that none of the spine bent. It's all about the hip. So we're there and then there. That is the movement that is taking place at the level of the hip. So when I do that stretch, if I just swap legs over and pop myself like so, slight bend, relax lower leg. This is where I'm going to feel it, about where my shorts cut off, back of the thigh here, nice tall posture, core engaged, and then I stick my bum back. And for me, that already kicks in right there. I can feel it down the belly of the hamstring muscle. If I was to lock out my leg, it focuses to the back of my knee. That is not good. We do not want that. So you want a slight bend, stick your bum backwards, and all of a sudden you're going to feel it kick in. Now, because we have a few degrees of movement at the level of the knee, we might be balanced and using some support. We can actually press down to eliminate some, not all, of the bend to intensify the stretch further and fine tune it. So pressing down a touch just helps get a little bit more stretch. Make sure that bum's stuck out. Make sure your core is engaged. Make sure you've got nice good posture as you're doing this. And that will allow you to hold the stretch in a comfortable position and just make those fine-tuning adjustments. You're going to do this stretch slowly for around about 30 seconds. Hold it for 30 seconds once you've got that position, and then you can do some of that fine-tuning that I mentioned to really make sure that you keep that stretch the whole way through. And that's pretty much it. When you're coming out of the position, again, it's always best to kind of just ease yourself out and slowly just give yourself some support. Don't just fly out of the position, because that's where accidents can happen. And then move on to the next leg. One of the biggest mistakes that people do make when they do the hamstring stretch, which is really, really common and easy to do, especially if you've got no back pain, is just rounding over like so. But you can see how much further I'm coming, and it kind of feels as though, oh, I'm so flexible, I can touch my foot. And then you straighten your legs out and so on and so forth. But my back is so rounded as I'm doing this. It's not really an effective means of evaluating my flexibility. Is it my back that's bent more? Is it my hamstring? Who knows? In a lot of cases, it's actually not that much hamstring. Most of it is just flattening of the lumbar spine. So you're not actually stretching the muscle that you want to stretch. And actually, like we said earlier, it's important that you can effectively target this. So if most of the movement is coming from your lower back, you're not feeling a thing in your hamstrings because you haven't isolated the hip movement. Avoid that mistake at all costs. It is a fatal one that will continually aggravate the lower section of your lumbar spine. The next one is going to be targeting the glutes. Now these glutes again are going to have an influence on the lumbar spine. They're so inextricably linked with that lumbar spine, just like the hamstrings. Their nerve supply comes out of this lower section of the lumbar spine, L4-5 and L5-S1. So what we're going to do to stretch these effectively is doing it in a sitting position. We're going to have our one leg out in front of us. Now, if you can sit like this and just yank your leg straight up on top without any real trouble, your hips and your glutes might not actually be that tight, but for some of you, it really will. So a nice little strategy is actually straighten the leg that you're not going to be stretching. And that allows you to pop your leg on here and then simply walk it up and then bend the knee to 90 degrees. That will help elevate. For some of you, this might well be enough of a stretch in the glutes and you don't even need to go any further. Now, the important training points here are just like with the last one, chest needs to be popped out. Sometimes that movement alone is actually going to help you, and I can already feel some activation of a stretch on my glutes just from going from a slightly less good posture, which is not good for the lower back, into a correct posture, and I can already feel everything kind of biting in that position now. Now what I'm going to do is I'm going to take this knee here, my right knee, and drive it towards my left shoulder. I'm going to just pull, and that movement there is all that's required to feel a nice broad stretch down in the buttocks, where all the attachments are to the sacrum, coming all the way round, and we hold this stretch again, just like the last one, for 30 seconds and then simply unload. Now, the important errors that people make here is they round over and curl up. Just like with the last stretch with the hamstrings, if you're rounding over, it's your lower back. You're not actually getting any stretch whatsoever, and the temptation to really collapse, to force it, is just unnecessary. And what's worse than that is if you do have lower back pain and you've been given poor instruction and are doing those sorts of modifications for this good stretch, then you're going to get yourself in an awful lot of trouble and start worrying about why it's not working and why your back pain is actually getting worse. So just to recap, chest nice and tall, core engaged, feel those lower back muscles engaged nicely. That action itself could be enough to get a nice stretch, and then simply hand, and then pull gently towards the opposing shoulder. Hold it there for 30, relax, and then go with the other side. Again, with the dismount, could be very similar. Slightly straighten the leg, let that leg go, and then we're done. Doing this on the side of the bed or chair is absolutely perfect. The nice thing about these stretches is that we can do them all on the side of the bed. So it really does make for a nice little way of winding down your day and getting ready to go to sleep. You know, we can put the lights down low just to make sure we're kind of really getting into that vibe. And it's just a fantastic way to get your practice in, because doing these sorts of things daily is really where they add up. Now, just like the rest of the exercises or the stretches that we've been through today, most of these, the error comes when we actually move our lower back, and this is no different. As we go into the hip flexor stretch, we're going to have our one leg on the side of the bed. The other leg is next to it. You can have a chair next to you as well to help, but use your arms to support yourself. commonly people will find this hurts their knee when they do it on the floor, and it's nothing to do with the knee problem, if you will. It's just they're not used to having the knee loaded with such a low bend through the knee at 90 degrees. So by doing it on the side of your bed, especially if you've got a higher bed, it's much more ergonomic for your legs and knees. So we're going to lean a little bit forwards, keeping the spine nice and neutral here. We've got our front leg here. We can lean a little bit on the top of the bed, and then just gently drive the front of your hip bone, so your groin, down towards the bed. And we're just going to move down into that position. And taking a good bit of weight on your upper body can help here. You've got a little bit of weight on the supporting leg, and we're just allowing ourselves to drive into the ground. If you want, you can engage your glute, engage the buttock muscles just here to help, but we should not be arching our back up like so. If you do that, you're going to find that you catch these little facet joints, you close the holes where the nerves come out of the bottom. That can often give you instant feelings of pain down the leg if you've got sciatica, or local lower back pain, be it sharp or just an aggravation. So when we're doing it, nice and supported, nice and comfortable, core engaged, back muscles nice and braced, go down into the position, support yourself effectively on the front, and almost think about pulling your hip down and forwards towards the bed, and hold that stretch there for 30 seconds. You can again here make slight modifications. For example, you could turn your leg out a little bit, move your knee slightly towards you guys where the camera is, and drop there, and you'll find that will slightly modify the feeling of stretch where you're feeling it in that hip or groin region. These little tweaks can make a significant change to make the stretch a little bit more targeted for you and your personal stiffnesses. Remember, you've got maybe the iliopsoas tendon, but it might not be the whole thing that's stiff. It might be that there are particular adhesions on one side or the other. And so by modifying the slight position, you're able to target that particular area that is most stiff. And you'll feel that, just like on the hamstring stretches, just like on the glutes. We've got a huge number of fibers here, and slightly modifying the exact direction at the level of the hip, nothing to do with the back, will help you make those extra nuanced adjustments that increase the effectiveness of the stretch. Hopefully you found those stretches and the nuanced approach to those, the specific targeted approach to stretching the hip specifically, or the muscles at the joint of the hip and not involving the lower back, helpful. It really will transform the effectiveness of these stretches, especially if you've got lower back pain, sciatica, of a variety of causes. At the end of the day, the more serious or sinister the causes of your lower back pain, significant disc bulges, spondylolisthesis, degenerative change in stenosis, those sorts of things are present. The more present they are for you, the more important you've got to get this right to make sure it is effective. Now, I mentioned at the start of the video, there's that one extra point, and that is this. I've alluded to a couple of times in this video that there are nerves that come out of that lower section of the lumbar spine, the section that often is aggravated when we do these stretches. And those nerves send signals to the muscles to tell them to go into spasm. This is why when we have relapses, especially early on, those relapses and flare-ups make stretching somewhat ineffective for any length of time. We're constantly having to remobilize the hips on a multiple times a day basis. And that's where strengthening comes in. Ultimately, if you're doing stretching without any significant strengthening components to your rehabilitation for your back pain or sciatica, you will not have success. And the reason for that is that it is strengthening and improvements in the strength of these muscles and others, of the core for example, that will start to protect your lower back on a daily basis. That means that you have less relapses, which means less frequently are those same signals and protective muscle spasm, or those signals going to those muscles and causing protective muscle spasm. And that in itself will improve your overall symptom picture. But not only that, as you get stronger and you have those fewer relapses, the stretching that you are doing is going to start to have compounding benefit as well. So make sure that if you are trying to alleviate your symptoms of lower back pain or sciatica, you must be doing these stretches correctly in conjunction with proper strengthening work. And if you need any help with that sort of stuff, that is the thing, that is the protocols that we talk about in the Back in Shape program. And you can click a little link above the head or in the description to learn more about that and how we help our members deal with their back pain from home. As always, thanks for taking the time to watch the video this far. We do hope you found it really, really helpful. If there were questions, use that comment section. Consider giving it a thumbs up if you did find the video helpful, to let us know what sort of videos you do find helpful. Some of you guys, we know you like the talking head videos where we go deep dive into a particular topic. Others of you like these sorts of videos where we do the demos, we show you what to do and how to do it wrong or correctly, as the case may be. So let us know in the comments, and we look forward to seeing you in another video.